All right, Aaron, thank you. Tasa, thank you guys for your hard work putting this all together. And hello to all of you that haven't seen in a long time. Haven't seen, and that's kind of a weird statement to say that we haven't seen each other. In a Zoom event again, but good to be with you. I'll keep my comments fairly brief. I know that the driving issue here is continuing as we deal with COVID-19 and what we're doing with COVID-19 as a community. And want to express my thanks to the hospital, to the health department, to the county, to the school district, really to everybody who has been involved ever since March. It's hard to believe we're almost to September here, and we're continuing to work through these issues on a constant basis. And so thanks to everybody for what they've been doing and taking care of our community. A couple of things that we're focused on at the city level. I know coming up here next week, there'll be more discussions about tax rates and different things like that. But that's another discussion for another time. I want to stay focused on how we're trying to deal with COVID and how we're trying to deal with the city. One of the things we're very concerned about, as all of you are, is the continuing opportunity to be able to open up our businesses and to open up our economy. But we want to make sure we're doing that in a very healthy and safe manner. In that regard, we're spending quite a bit of time talking to the governor's office, talking with our partners that are affiliated with the governor's office, trying to work on legislation in some areas where we can free up the things we need to do here in Midland, because we're not Dallas, we're not San Antonio, we're not Houston, we're not Austin. And we firmly believe that in cooperation with our hospital and our health department and others, there are some decisions and things we can make to be able to open some things back up and continue to move towards a safe and healthy opening of our economy here in Midland. There are some things that I'm working on with Russell in the hospital. We can't go into those details right now, but some things we're working on with the governor's office to maybe move us down the road to being able to open up even more outside of the restrictions that are dominating the entire state. We're working on those things literally within the last 24 hours. Not trying to hide anything from you. We're just trying to put some pieces together so we can give you a whole picture of what we might be able to do if we can get the support from Austin. So we're working on those issues as well. The other thing I want to speak to, and I spoke to this last night on Facebook Live, is our commitment at the city level to be a support to MISD. MISD is facing something that none of us could have ever imagined. And so even though they're in the midst of trying to figure out how to open, and they're trying to figure out how to do things virtually, and they're trying to figure out how to do things in person, I just want to take this opportunity to call out to our community to be very patient, to be very understanding, and to realize that when we're talking about 30,000 people, nearly 30,000 people with students and teachers and administrators trying to open up, it's really just a large petri dish that we have no idea what the experiment is going to produce. And there's all kinds of data out there in all kinds of directions and on all different sides, filled with all kinds of opinions. And we just want to be, as a city, as supportive as we can be for MISD to do what they need to do for the safety and well-being, not only of teachers and students, but also of families that these students go home to, understanding that we have many students who are being raised by grandparents who we know from the numbers have shown us are the most susceptible usually to the ravages of COVID-19. And so we don't want a student who is healthy being asymptomatic but carrying COVID-19, then going home and infecting a parent or a guardian who is susceptible to this, and then we have another problem. So I know our school district is working hard. We're standing behind them. We're supporting them to give them all the support we can give them, and thankful for everything they're going through, which is something none of us have ever gone through. So again, we're working with Austin. We're trying to work on legislation. We're trying to get things open, but continuing in our partnership with the hospital and the county and others to try to do these things as safely as possible. So that'll conclude my comments. Aaron, I'll be happy to take any questions.
All right, Sammy Steele has the first one. Sammy, whenever you're ready.
Hey there, Mayor. Hey, so you talked about how you've been working with the governor's office on potentially getting some places to reopen here. I don't know if you can speak to what those businesses or entities are. Bars, I imagine, might be one of them. Just what exactly do you have in mind to reopen sooner rather than later?
Well, the most difficult thing in answering that question is we've really reached this place as a city where we're about as open as we can get without violating governor orders. And the violation of orders given by the government, for instance, related to bars, is not just, you can't just go say to bars, hey, go ahead and open, and let's just tell the government we're not going to do what they say, because we put them in danger of their licensing issues. And we're also up against issues as far as crowd sizes and different things. And so what we're having conversations with related to Austin is just understanding that we are not exactly like a Dallas. Like I mentioned earlier, and it's not just a phrase, we're not like a Dallas, a San Antonio, or a Houston. We need some leeway so we can take care of what we need to take care of as a city. And we need that authority given back to us. One of the things we've continued to ask for is really the calling of a special legislature, a special session, so that the legislators can begin debating what's happening rather than running this thing by dictate. So we just want to be able to have the freedom to open up as we believe we should open up, with the expertise of our health department and our hospital, because we've already shown as a community how we can monitor it. And our community has already shown, even over this last month of July, how when we issue the call, listen, we got to get this thing under control. Now you look at where we are. We've done that twice as a city. We know how to manage our affairs. We know how to manage our health and take care of ourselves. We need to have the broader freedom out from under the restrictions of special declarations, that we can open the way we need to open. And so those are the things we're cooperating with and we're negotiating with. We're not making threats or anything like that. We're just trying to get some of our ability to run our city back. Does that help, Sammy?
Yep, it sure does. And then you have a Chamber of Commerce meeting at 11 today, right?
No, had a Chamber of Commerce meeting yesterday.
Oh, just kidding. Never mind. That'll be another interview another time.
Okay. Any other questions?
We'll give them just a few seconds before we turn it over to Whitney. Media, remember you can use the raise your hand feature. All right, well. Mayor Payton, thank you.
Thank you.
And now we will turn it over to Whitney Craig with the Midland Health Department. Whitney, whenever you're ready.
Good morning. Thank you for allowing me to update you guys. I want to start off by thanking everybody in the community for being so patient with us as we are navigating our new investigation/contact tracing system, Texas Health Trace. It has been a learning experience for all of us here, and it's been a daily challenge to navigate this new system, but we appreciate your patience with us as we learn it and we're able to get that information out to you the best we can. Our total cases right now are at 2,978. Of those, 1,008 are isolating, 1,366 are considered as recovered, while 398 cases are still under investigation. 145 have been unable to locate or have refused to speak with us, and we are currently at 61 deaths. I also did want to touch on our reopening plan. We have gotten to a point where we have been able to maintain our caseload here in regards to the COVID cases, new COVID cases that are becoming open, so that we can start shifting our attention to our clinical services that we have not been able to provide the community for so long. So as of tomorrow, we will start taking appointments for next week, starting Tuesday through Friday. Our appointment times will range from 8:15 to 3:45 p.m., 8:15 a.m. to 3:45 p.m., Monday through Friday. And we do have a few Saturday clinics that we have scheduled that we will have before school is scheduled to, or MISD is scheduled to open. And so those will be Saturday, August 29th and September 12th. And those will be 9 a.m. to 2 p.m. And we will still have our late clinic for September, and that'll be September 21st from 8:15 to 6 p.m. We will put this information out because I know I'm going over, giving out a lot of information. For appointments, you can call us at our normal number, 432-681-7613, and you will be directed to one of the front staff and they'll get you scheduled. Other than that, we've been very busy, and we look forward to opening our doors to the public again.
All right, Winnie, the first question comes from Stuart at the MRT. He asks, the number of recoveries seem low. Are we behind in tracking the number of recoveries? How many active cases are there?
Okay, that's a good question. So our recoveries are based on the patient themselves. It really isn't a time frame. And so for each jurisdiction, you're given the leeway on how you want to define your recovered. That direction hasn't come from the CDC. It hasn't come from the state. That's what we decide. So for us here in Midland, we don't just look at, okay, well, you're through your isolation period, so you're recovered. We look at how the person is actually doing on a medical basis also. We kind of look at what their symptoms, if they have this lingering cough that's requiring oxygen, we wouldn't consider them recovered because that's still something that they're dealing with as an impact of being infected with COVID. So our recoveries aren't really a set time frame. It is dependent on each case. And for active cases, it's going to be that the ones that we still have isolating and the ones that are under investigation. Right now, we're unable to locate / refuse. We really can't call them recovered because they haven't spoken with us and we haven't been able to get a hold of them through many attempts. So they're kind of in that, I hate to say it, in a gray area, because it's not, as we all know, COVID isn't black and white. So in regards to our active cases, it's going to be those that are isolating as well as those that are still under investigation. Did that answer your question? Okay.
Yes. And now Sammy Steele was the first one to raise her hand. So Sammy, whenever you're ready.
Hey, Whitney, I have a few questions for you. My first question, so how long have you guys not been able to offer your clinic appointments because, you know, it feels like it's had to be put on the back burner with COVID? How long has it been?
We have been closed since March 23rd.
Wow. So what are your typical appointments? That is a long time. You guys have been just knee deep in COVID stuff. What are the typical appointments or services that the community get from the health department that now they'll be able to receive again?
So of course it's going to be vaccines. That's going to be our priority. We have vaccines, of course, for school-age children, college included, as well as our refugees come to us for vaccinations. So that will be available as well. In regards to other clinical services, our TB patients, we can start seeing those again because that's required. The community is requiring some of that to even go back to college or to start some jobs. So we'll be able to do that again. In regards to our pregnancy and STD services, we will be screening those patients as we've been doing and have done in the past. And so that's why we encourage, you have to call for the appointment. Don't just show up with COVID. Everything's going to look different. So our reopening is going to look different. You will have to call for the appointment. We're not serving any walk-ins, and we will prompt the patients to fill out the forms online and bring them with them. That'll shorten down the time that they'll have to be here if they are able to fill out the forms online, bring them with them, and then we can get them registered faster.
And do you worry that we could see, another spike of COVID and you guys might have to go back to not allowing appointments and just focusing all on COVID and contact tracing? Is that a possibility?
That's a great question. So what we're doing right now, while our cases have kind of leveled off, we won't say that they're gone or they're even low, because once upon a time we were getting 1 or 2 cases a day. So we can't really say, okay, well, we're anywhere near that. But we are stockpiling staff. We're getting people in. We're trying to get people trained while there is this, for lack of better words, downtime with the COVID staff, we're trying to work on all of our back entry and that's, what the delay is. We've been working off of 2 separate systems, our previous system and now our current system, which is the Texas Health Trace that we were required to switch over to by the state. So, we're working on getting people in so that we can get them trained. We have people coming as early as additional staff coming as early as next week.
And just how many staff? Because staffing has cost. Sorry, say that again. How many staff?
And that would be, I'm sorry, did you ask how many?
Yeah.
Well, so actually city staff have stepped up recently to be able to, come and help us. So we have 10 additional staff throughout the city that are going through the training to be able to get into the system so that they can assist us. And then we have a temp agency that's looking for staff for us. So we have 4 staff on deck from the temps.
Great, because I know Ector County has had a really big staffing problem with their health department. They've brought in recruits from colleges and stuff on contact tracing. And speaking of contact tracing, Ector County is training some people with ECISD to do contact tracing within the schools. Is that something that the Midland Health Department is looking at doing with MISD?
We have talked, we've spoken with Imogene at MISD as a possibility for them to be able to do that on a smaller scale, just to kind of help with, especially within their facility, to be able to keep it under wraps. But of course, we would still do that here at the local health department.
Great. And then I just want to ask visually, sorry, everybody, I have so many questions, but is there any opportunity that media could get B-roll of the health department reopening and the appointments and stuff?
I'm sure we could coordinate something through Erin's office.
Erin, I'll reach out to you here in a bit.
Okay. Is that your last question?
Yes.
Okay, and now Mitch.
Hey, Whitney, I have a few questions about Ashton Medical Lodge. So it's my understanding that the reason the health department didn't speak up sooner about that cluster is that it's your policy to wait for businesses to announce a rising number of cases. When did the health department decide that it would give this kind of window for businesses to identify clusters and hotspots before the health department identifies them?
Well, we changed how we reported some months ago in regards to especially the nursing homes with the increased cases across the nation. It's just, they're a hotbed of cases. It's something that's not unique to us. It's not unique to Midland. It's not unique to the Permian Basin. It's something that nationwide they're dealing with. So the recommendation from us is that these facilities and businesses remain transparent, and they're the ones that make these releases to the public. When it comes to nursing homes, though, they are only per requirement meant to make releases to HHSC, which is their governing body. We don't here at the health department have any governing power over the nursing facilities. So it is our recommendation that they make the releases, and it became clear that a release was not going out, so we chose to do one ourselves.
How is that expectation, that recommendation, how has that been conveyed to nursing homes and local businesses, especially with talk of trying to open up more businesses in Midland?
Yes, it has.
I guess, how has it been? Like, how has that been dispersed to?
When we're as part of our investigation, we make our recommendations clear.
Okay, and I guess how much of a window do you give businesses before you guys step in and make an announcement?
There's nothing that's set in stone. I had spoken with a few people, realized it wasn't going to happen, and then we jumped on it.
I guess, have there been other clusters that you guys waited to announce or that haven't been announced, or you guys are waiting currently?
Sir, thank you for asking.
Oh, no problem. Those are all my questions. Thanks.
All right, and then the last one for now, Whitney, is how long or how many times does the health department try to contact someone before you consider them unable to locate or contact?
We try 3 times, and that's with any infectious or notifiable condition. It's 3 times, but we also do send out a certified letter if we have an address. So we make, at a minimum, those attempts.
Okay. That was the last one. Whitney, thank you. And Tasa, now I will turn it back over to you.
Thank you, Erin. Thank you, Mayor Payton. Thank you, Whitney, for joining us this morning. And now,
Wait, Tasa, you're muted.
thank you, Erin.
Sorry about that, everyone. Thank you, Mayor Payton. Thank you, Whitney, for joining us this morning. And I'll now turn it over to Justin Bunch with Midland County Emergency Management.
Justin Bunch with Midland County Emergency Management. Just give you a quick update of what we're doing here in the office. We continue to meet weekly with unified commanders that we set up at the beginning of COVID. And I just want to brag on everybody in the departments there. They've done really good, very professional. These guys know what they're doing. They're making my job really easy as far as emergency management. So just kind of kudos to them and the citizens of Midland for putting elected officials that have gotten people in those positions that have done so well. We continue the same thing. We're more of a logistics hub for this operation. So we're dealing with the state, getting resources in to make sure the health department, the hospital, the fire department, everyone has what they need to get things up and running and continue doing what we're doing. On the county level, one of the big things we're working on is getting jury trials back up and running. We're working with the court system and the Texas Supreme Court to ensure that we do that safely and in a timely manner so we can get the judicial system back up and running because we've got a big backlog. Other than that, that's all we've got with the county. Unless there's any questions.
Thank you, Justin. We'll give it just a moment to see if anybody has any questions. We have a question from Sammy Still. Sammy, go ahead.
Hey there, Justin. Okay, I don't know whether or not this is a question for the hospital or for the county, but I've been reading some articles out of Dallas that they have started to test people through a mouth swab rather than a nose swab. This testing seems like it was just made available. Is that something that the county is looking at offering or the hospital is looking at offering? I'm just kind of curious.
Yeah, that would be a question for the hospital. We at our level, we don't do the testing. The hospital stepped up in the beginning to provide that for the community, and we support the hospital in that mission. So we provide the logistics. For example, on the Coleman Clinic that we've started up, the testing over there, we provide the facility, the trailer with the power and the air conditioner, all the supplies they need to run that. But the hospital actually runs the testing and determines what kind of testing is done.
Okay. And then my other question for you, Justin, how are you working with other smaller counties around us when it comes to COVID?
A lot of it's through conferencing. For example, Odessa, Howard County, Ector County. I speak with my counterpart in those counties, and we all have conference calls with the state that we get on almost daily. And so we're communicating, making sure everybody has their resources. For example, I've had some resource requests that come from Ector County that I've had to fill just to help out, to send up to the state and get those resources for those folks in Ector County. So we're doing what we can to help each other and just get through this.
Right. Well, keep up the good work.
Thank you, Justin. It looks like that's all the questions for you today. Now I'd like to turn it over to Mr. Myers with Midland Health.
Good morning, everybody. Russell Myers with Midland Health. I'll start off with the hospital statistics, and then Sammy will come back and address your question in just a second. We have a census today of 166. Only 14 COVID patients. That's the lowest number we've had in a couple of weeks at least. 5 of those are in critical care with ages ranging from the 30s to the 80s. 9 in our medical unit, ages from the 30s to the 90s. 3 of our patients are on ventilators, a total of 7 ventilators in use in the hospital of our total of 44, so plenty of ventilator capacity. Emergency department traffic continues to be down. We saw only 109 patients yesterday, so that challenge continues. With regard to our employees, our workforce, we've reported several times that we've had concerns about the number of our staff who have either tested positive or had symptoms that required them to be quarantined. Those numbers have come far down from their peak in the 50s to now only a total of 8 employees who are quarantined. 4 of those are positive and 4 others are quarantined for other reasons. So that has helped our staffing tremendously, and that's very encouraging for us as our employees recover from relatively minor disease. The mayor mentioned that we're working together to try to do some things that might make it easier for us to make decisions to reopen. Among those is an interest in doing some broader testing. Testing resources have become a little bit more abundant recently. Sammy, your question about saliva testing or mouth swab testing, I talked with the state this morning. There is actually one lab in the state of Texas that is beginning to ramp up its ability to do oral swabs and may be able to do those in significant quantity. And that's a work in progress, but there should be some more clarity on that within just a few days. Also, there's been a good bit of news about the development at Yale of a saliva test that has been proven. It's under now emergency authorization by the FDA. The folks at Yale have stated that they intend to make their protocols available to complex labs around the country who can reproduce the ability to run those tests. It's not yet clear exactly what the timing of that will be, but we're staying close to that issue, and we'll talk more about it when we know more. But clearly there's a good bit of development of less invasive, faster turnaround testing that might allow us to broaden the swath of the community that we're able to test and get a better idea of community spread. And we hope that's useful in decision making as we go forward. In addition, just straying away from COVID for just a second, appreciate the health department's efforts to reopen their clinical services. I think we're all concerned about getting children immunized as we begin to think about going back to large-scale in-person school environments. COVID's not the only disease out there. We have to think about all the usual childhood diseases that we vaccinate for. Here in the next couple of months, we'll begin to talk about flu vaccines. That's going to be particularly important as we go into the winter. We want to be sure that people don't take unnecessary risk with the flu and compound the challenge we have with COVID by adding a flu outbreak to that. So a lot of things happening there. We are working with the health department. Whitney talked about their need to expand staffing and the success that they're having internally. We're also offering some Midland Health resources to them to help ramp up that, especially their vaccination program, and are hopeful that over the next few days we'll be able to announce some real specific plans for how that might roll out. We also have at least one site that is approved by the state to deliver vaccines under the state's childhood vaccination program. We talked to them yesterday, and we think that I think it's the week after next, we'll have our site live to also be another point of availability for vaccines. So watch for more information about that. And remember, it is very important to get children vaccinated before school starts if they're due for shots, as many of them will be. Finally, on the immunization front or the childhood wellness front, our friends at Midland Community Healthcare Services, that's our local federally qualified healthcare center. They have a very substantial pediatric operation, as I think most people know. I hope you've seen our announcement recently that operation has moved from its original site on Delano into our West Campus, into much larger, nicer quarters on the 3rd floor of the West Campus in the old hospital space. That pediatric clinic has relocated. It's going to be growing its capacity in the upcoming weeks. But right now, immediately, if you are a patient of Midland Community Healthcare Services Pediatric Clinic and your child has not had his or her Texas Health Steps annual wellness exam, please make an appointment to do that. As a part of that exam, they will deliver the child's vaccines that are necessary to start school. And we'll make the phone number available to call them for an appointment on our Facebook feed shortly. But they do have capacity. They're ready to see children, both who are established patients in the MCHS pediatric clinic and children who want to become established patients and need a provider. So please do call and take advantage of that opportunity, both for a wellness checkup and for whatever vaccines that your child needs. As I make ready to turn it over to the school district, we have had a lot of conversation with the schools, and as the mayor said, they have a very tough and unprecedented task ahead of them to figure out how to safely put up to 30,000 people back into gatherings that we haven't experienced for now 6 months. One of the big challenges that they have is figuring out what the right metrics are that they should be observing that indicate what the level of spread of disease is in the community and give them information about how to make safe decisions. I think the challenge, and it's come up in conversation with them several times, is that we really don't have a good, clean metric for that. We're encouraged by the fact that fewer people are seeking testing, which means fewer people are sick. Fewer of those people are turning out to be positive. We've now had 6 weeks in a row of reducing numbers of positive tests in our testing site, both the numbers of patients who are appearing for test and the percentage of those that are coming back positive. So while we consider those to be encouraging numbers and the hospital's declining census to be encouraging, under no circumstances do we believe that the virus has been eliminated from the community. That's not going to happen until there is a vaccination for the virus and or an effective treatment that can be used broadly to eradicate it. So as we consider reopening the community, as the schools prepare to send kids back to school in person, they're doing everything they can to keep them safe and to mitigate the risk. But there is still a risk. The virus is still there. We are preparing for at least a small spike in cases as we begin to regather in schools. That's probably going to happen. The challenge we have is we're facing competing needs. There's a need to get kids back to school. That's vital for their development. There is some risk involved in that, both for the children and especially for the adults that work with them. The school's challenge and what we hope to support them in doing is to mitigate that risk as much as possible. Can we drive it to zero in the short run? I don't think we can, and we have to recognize that fact. So we'll continue to work together closely to get better and better information to help the school district folks make the best decisions they can make, as well as to help the mayor and the businesses in our community decide how to safely and effectively reopen as this progresses. So I think that's all that I have to offer in terms of prepared remarks, and I'll be happy to take questions.
We have a question from Facebook regarding our August 11th press conference. She asked a question regarding if there was any new nursing home outbreaks in Midland. And then later on, we learned it came clear that there were some patients and employees coming out of Ashton Medical Lodge. Can you tell us how an outbreak in a nursing home is defined?
Well, I think if that question had been asked about an hour later than it was, I would have said yes to it, because almost immediately after that particular press event, we were informed of the Ashton outbreak. I don't think there's a hard and fast definition, but I would say if there are multiple cases that come up around the same time within a couple of days, and especially if they include both residents and staff, I would consider that an outbreak. Clearly what's happened at Ashton is an outbreak. I don't think there's any question about that. We learned about it a little later than would have been ideal. As Whitney discussed earlier, we had some hints of it because we'd seen a couple of patients come to the hospital, but I think they've managed it reasonably well, but we did learn about it a little late.
Thank you. Looks like that's all the questions we have from Facebook. Media, do you have, I'll give you a moment to ask any questions. We had a question just come in from Facebook regarding, are you still requiring people to have symptoms in order to be tested?
We are contemplating opening that up a little bit. We have more tests available to us today than we have had at any time through the pandemic. Not that we have more than we can use, but we certainly have a greater abundance than we've had. So if you have had an exposure that concerns you, I would encourage you to go ahead and call 68-NURSE. Chances are we will probably ask you to come on in and get tested. So we're loosening those guidelines just a little bit in the near term, and we're, as the mayor mentioned earlier, we are working closely with the state and trying to determine if we can get access to much larger capacity testing and perhaps be more intentional about a broader testing campaign in the near future, but we're not ready to do that yet. Those resources aren't quite available.
Thank you. Sammy has a question. Sammy, go ahead.
Hi, okay, my question is, with Ashton Medical Lodge transferring COVID patients to Midland Medical Lodge or to Dallas, do you believe that with this spike that we're seeing, they could be moved to the hospital like Midland Medical Lodge residents were, only a few months ago?
That's clearly a risk, Sammy. Of course, if they've moved them to Dallas, they're much less likely to come here for care. They'll be more likely to go to hospitals in Dallas as that becomes necessary. But clearly, this is an at-risk population. Once they're positive, I think they do have isolation capability at the Midland Medical Lodge. But if their symptoms worsen, they are going to come to the hospital, and that's part of what we're prepared for. Even though our census is down, we have kept the reserved medical and critical care beds available in the event that the census should spike back up. So we're prepared for that to happen. We hope that it doesn't, but certainly it's a possibility.
Yeah, and then kind of switching gears here, but I've done a story with you guys on this before, but the hospital provides a donation center for breast milk for preemie babies, just like you would, convalescent plasma, just a bank of that. I'm curious, how can mothers donate breast milk, or is that a supply that you guys are really running low on because of COVID?
Yeah, Sammy, I can't tell you that I was prepared to talk about that today. But
it's so random, but I just got a message from a mom with a preemie, and she was asking me about it. I was like, that's a great question. I haven't thought about it.
Yeah, we're not prepared to answer it at the moment. I'll tell you what, we'll get you a good answer for that, and we'll post it to our Facebook site. So people, if they want to donate breast milk or have questions about how the process works, we'll be happy to answer the question. I'm just not prepared to do so right now.
I know, I really threw you. Just threw you.
Heads up next time. I'll be ready.
Yeah, okay, sounds good.
All right, we have a question from Facebook. When will you be allowing visitors again?
That is a popular question, and one that I know is a hardship for many families and patients. We talk to them virtually every day that are concerned about that. We continue to follow the directive that the governor has put in place for the entire state with regard to hospital visitation. That has not been relieved as of yet. We certainly believe that some loosening of those restrictions is a possibility, but until the governor says go, we're not in a position to change our policy. So remember, we're not at zero visitors. We are allowing a visitor to come with an emergency patient. We allow a parent to come with a child. We allow a support person to come with an OB patient, and any patient who is incapable of speaking for himself or herself may have a guardian or a power of attorney, someone with power of attorney attend with them. And then finally, patients who are at the end of life, we do allow families to visit them. So it's a pretty broad swath of patients who are allowed some limited visitation, but most of our outpatients can't have someone with them. They come in for surgery alone. Those are challenges. And absolutely, as soon as we are allowed to do so by the governor, we will loosen our restrictions and allow more visitors, but we can't do it yet.
Thank you. I believe that's all the questions we have for you today. I'd like to turn it over to Dr. Atkins with MISD. Dr. Atkins?
Hi, everyone. Good morning. I'm glad to be with you. My name is Dr. Katie Atkins. I am the Chief of Staff, Midland ISD. I want to start off by thanking our incredible teachers, our custodians, our principals, our maintenance crew, and all of our staff in a successful start to school yesterday, August 19th. They have done an incredible job preparing for a school year unlike any other in recent memory, and I'm very proud of the first day that they made happen. With that, I want to also thank all the moms, dads, grandparents, aunts, uncles, friends, family members who have stepped up in a tremendous way during this time to help their students navigate school. We know it involved making sure that they were set up with Wi-Fi, a learning device, making sure passwords were correct, and providing that reassurance that the first day would be all right. So we appreciate everything that everyone has done to make sure that we are able to start off in that way. As you're aware, MISD started the school year with the at-home learning model. It's our hope and desire to bring our students back earlier, if at all possible. And based upon what we are hearing from our medical community, the medical information that we are continuing to get updates on, indications are that we are on the right track to make this happen. Our return to campuses would include a phased-in approach during this 4-week period to lead into our blended learning model. This is where a majority of students would attend school on alternate days, sometimes referred to as the A day, B day schedule. This would allow us to take a cautious approach to reentry to in-person learning. We would start by bringing our youngest students, particularly pre-K2, and our students with special needs back first for 5 days a week, and then build up from there and ramp up and continue to monitor and adjust as needed. Students who were concerned about returning in person would always have the option to continue to participate in the Midland ISD Online Academy. Let me also add that we have not applied for a second 4-week waiver. There's something that there's been confusion around that in the community. So I did want to specify that we're not looking to extend past this 4 weeks. Rather, we're wanting to use these 4 weeks to build in a phased-in approach to in-person learning to the blended learning model. Waivers require the approval from our school board, and so that's not our intention at this time. Couple things that I do want to clarify when we have a case on campus, as I know that other school districts that have opened up have experienced those. We will experience those as well, and we are going to be proactive in that approach. So what happens when we have a case? We have an employee who is required to fill out a form and self-report. So when our employees are having cases, they self-report. We have deep cleaning and sanitizing that occurs. We have had that happen throughout the summer, and our cleaning crews have been very responsive in doing so. Closure would occur if necessary, otherwise in just that office area. The whole campus would be notified and close contacts notified as well. And then we also post that information on our website so that the community is also aware of any COVID positive cases that we have in our district. And that location, it's www.midlandisd.net/COVID-board. So for now, the best thing that you can do to help with your child's learning is to start developing your relationship with your home campus. I know our teachers, our principals have been reaching out to you with their back to school messages. They also implement a variety of other communication avenues such as Facebook, Class Dojo, things of that nature. Teachers, counselors, principals are there to help. They want to help and be responsive to your needs. Please also check the district website and social media. There are many helplines and links that we have set up. And I also want to make sure that parents are aware that the technology helpline hours have been, I think there was some confusion about that. Those are from 7:30 a.m. to 8 p.m. That number is 432-240-1110. I will I'll take any questions that anyone may have at this point in time.
Muted. Okay, sorry, I was muted. We have a question from Stuart Doreen at the MRT. What was the student population for day one, and how does that compare to last year?
So right now, what we have done is we are looking at our students right now are in an asynchronous model. And so what that allows them to do is work on their academics at their own pace. And so what we are asking our teachers to do is knowing that they can work on that throughout the day. There's not a specific reporting period right now while we're in an asynchronous model. So what we are having our teachers do right now is put in the attendance from yesterday's. So Stuart, I certainly want to share that information with you once we do have it. But right now we have to understand that we are in that asynchronous model, and to allow that flexibility, we did allow them to plug in, at different times throughout the day. So to say, normally if we have a reporting period, if it's 9 a.m., then we know how many, but because we're in the virtual asynchronous platform, we're getting that information today on how many plugged in yesterday. Good question though, thank you.
We have a question from Sammy Still. Sammy, go ahead.
Yeah, I have a question about the hotline that you guys have created. We got a few reports from parents yesterday saying that they were on hold all day and that they were just trying to get their kids set up. And these were parents of kiddos who are older, and so they are more familiar with technology, and they were still having a hard time. How exactly are you guys going about manning that hotline and making sure that everyone's needs are met?
Yes, so what we are going to make sure that we are expanding that capacity. I think the first day of school we can anticipate how many would call in. I apologize if people were on hold for a definite amount of time, but that we are going to increase those numbers so that we can be responsive to our community needs.
We have another question from Stuart Doreen. Will grades A through F be part of the at-home learning period?
So we will continue to provide grades as if they were in person. So whereas during the spring semester there was a progress monitoring measure in place, students will be getting their percentage grades. So 95, 86, things of that nature. So it'll be consistent across the district in that regard.
Thank you. We have a question from Facebook. Are you requiring third parties to wear PPE when visiting campus, as in HVAC workers, water department, etc.?
Yes, that's what we have in place per the governor's order, executive order.
Thank you. Will you be adjusting your attendance policy to encourage parents to keep kids home if they do not feel well?
So we are continuing to revise our policies and continue to be informed by TEA on how we can do so. We certainly want, if students are not well, we want to make sure that they do not come to school sick. And so I think that's different than in the past. People have tried, okay, and teachers as well. I'm going to come, I'm going to, and I don't feel well, but I'm going to tough it through. We need to make sure that we're making some smart decisions. And so that's continued conversations that we're going to have to make sure that we're messaging out. We certainly we want people to come to when we are back in person, which we hope to be very, very soon. We want people to be well when they are on campus, but it's important to get that message out. So we'll be updating and making sure that we're messaging that out.